from Occupational Therapy. Do you mind if I pull up a seat?
Sure.
Thank you. So my name is Beth Pearson. I'm an Occupational Therapy Assistant student at Austin Community College, and I'm here today to do some manual muscle testing of your shoulder girdle. Should only take about 15 or 20 minutes. Before we get started though, could I see your name badge and get your ID bracelet and get your full name?
Darcy Richards.
Okay, great. How are you feeling today?
Good.
Are you having any pain at all today?
No.
Okay, so on a scale of 0 to 10, with 0 being none and 10 being absolutely excruciating, how would you rate your pain?
A 0.
Just a 0. Okay, good. Well, you shouldn't feel any pain with the activity that we're doing today, but if you do, definitely let me know and we'll stop immediately. So as I said, we're going to be doing manual muscle testing of your shoulder girdle. That's going to help me assess whether you have sufficient muscle power to start swimming again soon. The way that it's going to work is I'm going to have you put your arm and shoulder into a variety of different positions and have you hold that position against resistance. So I'll be giving you instructions as we go along as to where to put your arm and what to do. In order to do this, to take valid measurements, I'm going to need to place my hands on you in order to position you properly, stabilize your joints, and isolate the muscles that we're testing. Do I have your permission to do that?
Yes.
Okay. As I go along, I'm going to be listing out some numbers. You'll hear me say some numbers to rate your muscle power. The way the rating scale works is that it's out of a scale of 1 to 5, 0 to 5 actually. And if I say that you have 5 out of 5, that means that you have normal muscle power, and that means that you can move your arm or the joint through full range of motion against gravity, and that you don't break under a maximal resistance. If I say that you're a 4 out of a 5, that means that you have good muscle power, and that means that you can move your arm through the full range of motion against gravity, but you do break under maximal resistance. If I say that you're a 3 out of 5, that means that your muscle power is fair, and that means that you can move through the full range of motion against gravity, but you break under any resistance. Rating of 2 out of 5 is poor muscle power. That means that you're able to move through the full range of motion, but only in a gravity-eliminated plane. If I say that you're a 1 out of 5, that means you have trace muscle power. Which means that you can move, you can't move your arm, and but I can feel the muscle contract. And if I say that you're a 0 out of 5, then that's a rating of 0, and what that means is that there's no motion and no muscle contraction. Do you have any questions about that, about what we're going to be doing today?
No.
Okay, are you ready to get started?
Yes.
Okay, great. So, let me clear my environment. Before we get started, again for validity, I want to make sure that you have proper posture, so I'm going to do a quick postural assessment. If I can have you move forward in the chair, just to the edge, keep your feet flat on the floor, about shoulder width apart, and put your palms forward like that. Yeah, sit up nice and tall, thanks. Just going to be viewing you in 3 planes, so your sagittal, frontal, and transverse plane. I'm looking for rotation in your transverse plane, symmetry, and alignment. Just want to make sure your scapula are nice and symmetrical. Everything looks good. All right, excellent. So you can relax. All right, how do you feel? Any pain?
No.
Okay, good. All right, so the first motion that we're going to be testing is scapular abduction and upward rotation. So I'm going to have you sitting the way that you are, but you can put your arms down at your side. I'm going to place one hand here just to stabilize your scapula. And what I want you to do is raise your arm to about eye height, and then you're going to reach for the top of that cabinet. Hold that, perfect, hold that, don't let me push you down, okay? I apply resistance at the distal forearm, just proximal to the elbow, and you're good, you can relax. So that was a 5 out of 5. Do you have any pain?
No.
Okay. If I were testing you for a 2, then you would stay in the same seated position. I would support your arm just over 90 degrees, and I would palpate the serratus anterior, which is the prime mover of this motion, just along the axillary border of your scapula along ribs 1 through 8. Okay? All right. So the next motion that we're going to test is scapular elevation. And the prime movers here are your upper trapezius and your levator scapula. So again, I'm going to have you stay seated the way you are. You can place your hands in your lap. Perfect. And I'm just gonna stand behind. I'm going to have you raise your ear or shoulders to your ears. Hold that. Don't let me push down. Apply resistance with my hands contoured over the shoulders. Okay, good. You can relax. So again, you were a 5 out of 5. Do you have any pain? How are you feeling?
No.
Good, no pain? Okay. If you weren't able to do that, in order to get you into a gravity eliminated plane, I would actually place you prone on the bench with my hands supporting your shoulder, and I would palpate your upper trapezius on the lateral 1/3 of the posterior clavicle. Okay, all right. So for this next one, I'm gonna have to have you get up here. You're gonna lie prone on this mat, which is face down here. Yeah, yeah, you can put your head in for this one, either side, whichever's more comfortable. Yeah, let me just raise up the bed, make sure you're stable there. So what we're testing on this one is scapular adduction. The prime movers are the middle trapezius and the rhomboid major. So what I'm gonna have you do is hang your arm off of the, let's have you do it here on the side, yeah. Perfect, so that your arm is adducted to 90 degrees, your elbow is flexed to 90 degrees as well, and your hand and forearm are hanging off the bench. Okay, and I'm gonna place myself here. I'm gonna stabilize the contralateral scapula because I wanna make sure that you're not having any trunk rotation. Okay, Darcy, what I want you to do is raise your elbow to the ceiling, hold it, don't let me push down. Apply resistance at the distal forearm, just proximal to the elbow. Okay, that's good, you can release. Excellent. Now, if you weren't able to do that, I would keep you prone on the table, support under your shoulder, and I would palpate in the middle trapezius, right at the vertebral column between T1 through 5. Okay, do you have any pain?
No.
How are you feeling? All right, good. Okay, so for the next one, you can stay in the position you're at. What we're testing for this is scapular adduction and depression. So what I want you to do is raise your arm to about 145 degrees. It's going to be diagonal across the corner of this table, just like that. Yep, with your forearm neutral and your thumb facing the ceiling. Perfect. And I am going to palpate the middle trapezius. This is the middle trapezius and lower trapezius fibers that power this motion. So I'm just going to stabilize across the scapula with my fingers at the thoracic vertebrae. What I want you to do is lift your thumb towards the ceiling, hold it, and don't let me push down. Perfect. All right, so I apply pressure. You can go ahead and apply resistance at the distal forearm, just proximal to the wrist. And that was a 5 out of a 5. Did you have any pain doing that?
No.
No? Okay. If I were going to test you for a 2, then I would support underneath the arm. And since I had already palpated the middle trapezius fibers previously, I would palpate this time at the lower trapezius, which is down along the vertebral column T6 through 12. Okay? Okay, so for the next one, what we're going to test is scapular adduction and downward rotation. So what I'm going to have you do is place the back of your hand against the small of your back. So that means your shoulder is internally rotated, your arm is adducted across your lower back. Okay, good. How you feeling? And your head is facing properly. Okay, good. So for this, I'm going to place and stabilize my hand just under the vertebral border of your scapula. What I want you to do is raise your palm to the ceiling and hold your hand there. Don't let me push down. Good. So apply resistance at the distal forearm, down and away. Okay, good. Do you have any pain with that?
No.
No? Okay, excellent. So if you did feel pain, or if you weren't able to do that rather, then what I would do is go ahead and lower you down, stay where you are. I'm gonna just lower the mat down. And I would put you in a short sitting position like you were in the chair. You would put your hand behind your back just like you have it now, and I would support at the wrist, and then I would palpate your rhomboid major and minor just underneath the vertebral border of your scapula. That's the prime mover for this action. Okay, Darcy, you can go ahead and get up and sit down. Okay, yeah, if I can have you sit there. I'm gonna get some blocks so that you're able to lift yourself up here. Okay, you're in good position. If you can move just a tiny little bit so this isn't on the edge. Okay, perfect. All right, now let me get situated here just so you're safe. Okay, if I could have you move forward to the edge of the mat. Good. And then you're gonna extend your feet out in front of you and cross your knees at the ankles. And this is so that you're not overcompensating with your quads. Okay, and go ahead and put your palms flat on these blocks. So what we're testing now is scapular depression. The prime mover for this is the latissimus dorsi. So what I'm gonna have you do while I observe, I'm just gonna kind of keep my hands here so you're safe, is push flat up off the blocks and lift your bottom off the mat. Okay, great. Yeah, you can relax. So that would be a 5 out of a 5. If you weren't able to do that, I would come around to the back, and I think I'm actually going to go like this so I don't fall off, and I would palpate bilaterally on the lateral aspect of the thoracic wall, feeling for the latissimus dorsi as you push up, and that would be to test for a 2. Are you feeling any pain with that?
No.
No? Okay, good job. So we have wrapped up the assessment. You can relax. And if I could have you get back into this chair, we'll just kind of wrap up. Okay, so Darcy, at the beginning of this session, you reported a pain level of 0 out of 10. How would you rate your pain now?
Still 0.
Still 0? Okay, that's great. So as I said throughout, you were scoring 5 out of 5 on all of the muscles we tested, which means you have normal muscle power. And that leads me to believe that you have sufficient muscle power to start swimming again soon. But since the scapula and the shoulder work together, we do need to continue to do testing on your shoulder joint, your shoulder muscles, to make sure that you have, again, sufficient muscle power to swim. So I'll be back on Monday, and we'll do a similar exercise today with different motions just to test the power in your shoulder joint. Do you have any questions about what we're doing or what we did today or what we're going to do next?
Nope.
All right, then thank you very much for all your work today, and I will see you on Monday.
Really? Is that it?
You placed safely in your chair with your call light. What did I forget?
Keep going. You're on the right track.
Okay, and be placed safely in the chair with the call light. Clear my environment. Thank you very much, and I will see you on Monday.
Good job.